All right, welcome back, everybody, to another deep dive.
It's good to be back.
Today, we're doing something a little different. We are diving deep into a list of 200 drugs.
Wow.
All created by...
That's a lot.
It is a lot. It's very impressive.
Yeah.
Created by Dr. Khaled M. Hasan, who is a professor of clinical pharmacology.
Oh, wow.
And he's provided us with this list. So it's really...
So he's like the ultimate expert.
He is.
Yeah.
Yeah, so it's kind of like getting a personal lecture.
That's amazing.
From a pharmacology expert.
Yeah.
He's organized these alphabetically.
Okay.
Listed both the generic and the brand name for each drug, along with a brief description of what it's used for.
So like Tylenol, Acetaminophen.
Exactly.
Yeah.
Gives you a sense of the sheer variety of medications out there.
Yeah.
We're diving deep today into something, well, pretty fascinating, I think.
Yeah.
The top 200 most prescribed drugs in the U.S.
Oh, wow. Okay.
It gives you a really interesting snapshot of, like, what are the most common health issues that we're facing?
Yeah.
And, you know, we're just tackling Section A today. There's a lot more to come.
Yeah.
But even just in this section, I mean, you've got everything.
Oh, yeah.
From, like, basic pain relievers to, like, hardcore antiviral medications, things for your lungs, even gout medication.
Oh, that's a range.
Yeah. So let's just jump in, see what we got. So first up, we're starting with a kind of a familiar face. Acetaminophen.
Oh, yeah, of course.
Tylenol.
Right. Most people know it as Tylenol.
Yeah, exactly. I mean, it's in basically every medicine cabinet in America.
I feel like, yeah.
Pain relief, fever reducer, the classic.
Yep.
But then there's also Fioricet.
Okay.
Which is interesting.
What's that?
It's actually a combination.
Oh, okay.
It has acetaminophen in it, but it also has this thing called Butalbital.
Butalbital. Okay.
Yeah, have you heard of that?
I can't say that I have.
It's a barbiturate.
Oh, okay.
So it's a,
right, yeah.
It's a serious pain reliever. They put them together. Super strength.
So it's for like more intense pain?
Yeah, exactly. Migraines, things like that.
Oh, got it. Like when you need like the extra boost?
Yeah. You know how like sometimes over-the-counter meds have like a million ingredients?
Right, right.
This is kind of like a prime example of like why that happens.
Interesting.
Yeah. Okay. So moving on.
Okay.
We've got a category here that I think will resonate with pretty much everyone.
Right.
Cold and flu.
Oh, of course.
The combo meds.
Yeah.
We've all been there, right?
Yeah. Middle of the night, can't breathe, got to stop the cough.
Exactly. And, you know, they basically all have the same players, right?
Yeah, right.
Acetaminophen, always there.
Yep.
Then dextromethorphan
right.
for the cough.
Right.
And then to dry everything up and knock you out so you can sleep. Doxylamine.
Makes sense.
It's like the trifecta of nighttime cold medicine.
It's like they know exactly what we need.
Right.
Okay, so we're talking about viruses. There's another one on here that's interesting.
Right.
Acyclovir.
Okay.
Also known as...
I've heard of that one. Isn't that for herpes?
It is.
Like cold sores and stuff?
Yep. And genital herpes.
Oh, wow. So it works for like all kinds of herpes.
Well, all these conditions are caused by different types of herpes viruses.
Okay.
And acyclovir can actually treat a lot of them, like shingles too, you know?
Wait, really? Shingles is herpes?
It is. It's caused by the varicella zoster virus.
I had no idea.
It's the same one that causes chickenpox, actually.
Wow. Okay. But hold on. So how does that work? Like, how can one drug target all these different viruses?
So it's pretty cool, actually. Acyclovir targets a specific enzyme that these viruses need to replicate.
Okay.
It basically blocks their ability to, like, copy themselves and spread.
Oh, so it's like a master key, kind of?
Exactly.
That's really interesting.
It is.
Okay. Let's move on. What else have we got?
Let's talk about breathing.
Okay.
We've got albuterol on here.
Albuterol.
The rescue inhaler.
Oh, right. For asthma.
Yeah, asthma and bronchospasms.
This is like instant relief, right?
Pretty much. It works really quickly to open up your airways.
Yeah.
And then for people with COPD, you know, chronic obstructive pulmonary disease, there's an inhaler called Combivent Respimat.
Combivent Respimat.
It's a combo.
Okay.
Albuterol plus Ipratropium.
Interesting. So how does that work? I mean, why combine them?
They actually work in slightly different ways.
Oh, okay.
But together, they're like extra effective at opening up those airways and helping people breathe easier.
So it's like a 1-2 punch.
Exactly.
Makes sense. Okay, what else is on the list?
Just switching gears a bit, we've got Alendronate.
Alendronate.
Brand name Fosamax.
Oh, right, for bones.
Exactly. It's for osteoporosis.
Yeah, to like help prevent fractures and stuff.
Exactly. It helps to slow down the breakdown of bone. You know, as we age, our bones can weaken, and this helps to protect them.
Oh, okay. So it's not just about like building new bone.
Not really, no. It's more about preserving the bone you have.
Interesting.
Yeah.
All right, next up.
Okay, this one's especially for the men listening.
Oh, yeah.
Alfuzosin.
Alfuzosin.
It goes by Uroxatral as well.
Okay.
And it's specifically for benign prostatic hyperplasia.
Try saying that 3 times fast.
I know, right? But it's also known as BPH.
BPH.
It's a pretty common condition as men get older.
Okay.
Their prostate gland can enlarge and it can make it difficult to pee.
Oh, right. I've heard of that.
Yeah, and that's where alfuzosin comes in. It helps to relax the muscles in the prostate and the bladder.
Okay.
So it makes urination a lot easier.
Makes sense.
Okay, now for something maybe a little less familiar, gout.
Gout.
Yeah, you ever heard of it?
I mean, I've heard of it.
It's actually a type of inflammatory arthritis.
Oh, wow.
Yeah, and it can be really painful. Like suddenly you have this intense pain in your joints.
Ouch.
Yeah, no fun. And the medication on the list here is allopurinol.
Allopurinol.
Also called Zyloprim.
Oh, yeah.
And it basically lowers the level of uric acid in your blood.
Oh, okay. And that helps with gout.
Yeah, that's like the root cause of gout. Too much uric acid.
Interesting.
It is. And you know what's interesting is that gout's been around for centuries, right?
Interesting.
Oh, yeah. But the old treatments, let's just say they were a little out there.
Oh, right.
Yeah, like really out there.
Right.
So allopurinol is definitely a sign of progress.
Makes sense.
All right, moving on.
Oh.
We're getting into mental health territory now.
Oh, okay.
Alprazolam.
Alprazolam. All right.
Probably better known as Xanax.
Oh, Xanax. Yeah.
It's a benzodiazepine.
Right.
Really helpful for anxiety and panic attacks. But, you know, they can be habit forming.
Right.
Important to use them carefully under a doctor's supervision.
Yeah, definitely. Okay, back to physical health then.
Sure.
What's next?
Amlodipine.
Amlodipine.
Norvasc is the brand name.
Okay.
It's a calcium channel blocker.
Okay.
Helps with high blood pressure.
Right.
And angina,
Angina.
which is chest pain.
Oh, right.
Basically, it helps to like relax and widen your blood vessels.
Okay.
So your blood can flow more easily.
Oh, so it's like the opposite of like when your blood pressure is too high, it's constricted.
Exactly.
So this is like opening things back up.
Exactly.
Interesting.
It is.
So it works differently from like aspirin, right? Which we know can help with heart things too.
It does.
Okay, what else is there?
All right, this one might surprise you.
Okay.
Amitriptyline
Amitriptyline.
or Elavil.
Elavil, okay.
It's technically an antidepressant,
Oh, interesting.
but they also prescribe it for like chronic pain and migraines.
Wow. So wait, it works for like totally different things.
Well, it's all about brain chemistry, right? Our understanding of how the brain works is constantly evolving.
Right.
And, you know, sometimes medications can have these like unexpected effects on different conditions. Like they target multiple neurotransmitters and those can play a role in both like mood regulation and pain perception.
Oh, that's fascinating.
Yeah, it really is.
All right, so back to fighting infections then.
Sure. We've got amoxicillin on here.
Amoxicillin.
Yep, classic antibiotic. Works against a whole range of bacterial infections.
Yeah.
But here's the thing.
Yeah.
Bacteria are sneaky.
Right?
They evolve. They develop resistance to antibiotics.
Oh, yeah.
And that's where augmentin comes in.
Augmentin.
It's amoxicillin, but with clavulanic acid added.
Okay.
And that clavulanic acid helps to like fight that resistance.
Oh, so it's like a booster kind of.
Exactly.
Wow.
Keeps the amoxicillin effective.
It's like a constant battle.
It really is.
Okay, what else have we got?
All right, let's talk about a heart condition called atrial fibrillation.
Atrial fibrillation.
It's an irregular heartbeat,
Mm-hmm.
and it can significantly increase the risk of stroke.
Oh, wow.
Yeah. So we've got apixaban on here,
Apixaban.
also known as Eliquis.
Okay.
It's an anticoagulant.
Okay.
And it helps to prevent those strokes in people with atrial fibrillation.
So it's like a blood thinner.
Yeah, exactly.
So if you have atrial fibrillation, is that like an automatic prescription?
Well, it really depends on individual risk factors, right?
Yeah.
Everyone's different.
Right.
So it's important to talk to your doctor, figure out like what your personal risk profile is,
Okay.
and then, you know, create a plan together.
Makes sense. All right, what's next on our list?
We're coming back to a familiar friend,
Okay.
aspirin.
Oh, aspirin, yeah. The multitasker.
Right. Pain relief, fever reducer, A&D.
Heart health.
Exactly.
It really does it all.
It really does. And then we've got atenolol.
Atenolol.
It's a beta blocker.
Okay.
So it's prescribed for high blood pressure,
Right.
angina, and even heart failure.
Wow. Okay.
Basically, it slows down your heart rate
Okay.
and reduces the force of your heart contractions.
So it's like calming your heart down.
Exactly.
So atenolol and amlodipine, they both target blood pressure,
They do.
but they work totally differently.
Different mechanisms, yeah.
Interesting. It's like there's so many different approaches to these problems.
There are.
Okay. What else is on the list?
Let's talk about ADHD,
Okay. Yeah.
atomoxetine,
Atomoxetine.
or Strattera.
Strattera. Okay.
It's a non-stimulant option for ADHD.
Oh, interesting.
Yeah, because, a lot of the ADHD medications are stimulants,
Right.
but this one's not.
So it's like a different approach to treating it.
Exactly.
Interesting. So do doctors usually try the non-stimulant options first?
Not necessarily.
Oh, okay.
It really depends on the individual,
Right.
what their symptoms are, their preferences, their medical history.
Yeah.
It's all about finding the right fit.
Yeah. Okay. That makes sense. All right. So back to heart health then.
Sure.
What do we have?
Atorvastatin,
Atorvastatin.
or Lipitor as it's commonly known.
Lipitors, yeah, I've heard of that.
It's a statin medication,
Right.
and it's really effective at lowering cholesterol,
Okay.
which, is super important for heart health.
Yeah, absolutely. I mean, high cholesterol is like one of the biggest risk factors for heart disease, right?
Exactly.
So managing that is like crucial.
Exactly.
Okay, so we're almost through section A of this list. What's the last one?
Last but not least, we have azithromycin.
Azithromycin.
Zithromax is the brand name.
Oh, Zithromax.
It's another antibiotic.
Okay.
And, like we were talking about before with antibiotic resistance, it's really important to use antibiotics appropriately,
Right.
only when they're truly needed. Yeah.
Because overuse can lead to those resistant bacteria,
Yeah.
which are a huge problem.
Yeah, absolutely.
So just a reminder to everyone listening, talk to your doctor before taking any antibiotics.
Yeah, good advice.
All right, so that's it for Section A of the top 200 most prescribed drugs.
Wow, we covered a lot of ground.
We did, from pain relief to heart health to mental health to fighting infections.
Yeah. It's amazing to see, the range of medications that are out there
It is.
and what they're used for.
Yeah,
I mean, were there any surprises on this list for you?
definitely a few.
Yeah, me too.
It really makes you think
It does.
about, what are the most common health concerns,
Yeah.
how we're addressing them. It's like a window into our collective health as a society.
Yeah, absolutely. And I mean, I might even spark some conversations with your own doctor. Right.
Exactly.
Hey, I heard about this drug on a podcast.
Right. Tell me more.
Exactly.
So that's Section A.
But there's a whole lot more to explore.
Oh, definitely.
We're just getting started.
Right. This has been a fascinating look at just a handful of the drugs that Dr. Hasan has developed.
Yeah.
I mean, from pain relief to heart health to mental health, and even addressing the side effects of other treatments. The range is incredible.
It is, yeah.
It really highlights the breadth of knowledge and expertise that's involved in creating medications.
Absolutely. And it makes you appreciate the impact that these discoveries have on countless lives.
Yeah, huge thank you to Dr. Khaled M. Hasan for sharing this list and for his contributions to the world of medicine.
Absolutely.